So this is a prospective registry that we conducted in Humanitas with the support of Elixir, with a core lab, independent core lab by Francesco Prati, only for complex lesion, long lesion, total occlusion, bifurcations, acute coronary syndrome, with OCT as a baseline and repeat OCT at 9 months with follow-up angiogram, of course. So I'll show you some cases to give you the idea. These are not so selected cases. These are the type of cases we enrolled in these registries. This is a total occlusion of the right coronary artery, opened and did a lesion predilatation with a very old-fashioned technique. Personally, I don't use such a long stance, but I think we were a little bit confident that you can be healthy to healthy approach. We implanted the long stent in this case. We did OCT and let me go back to the follow-up. It's okay. Look at the OCT at follow-up. The stent area at the baseline was mean stent area 486. At the follow-up 5.5, and if you look, these are contemporary, you see that in some spot the vessel is really larger. Not everywhere, but in some part the vessel is larger. This is another case, diffuse calcific LED. This is a long LED. We will not implant long stents anymore in this type of lesion. We will try to do our best with a drug-coated balloon, but in this trial we kind of accepted this approach of almost full metal jacket, and you see stents from here to here, which is something that we normally don't do anymore. This is a 9 months follow-up. The lumen is well preserved. There's really basically there's some overlap here, but even as the overlap is perfect, there's a little bit of minimal gap here, but no loss. And this is remarkable. This is a steel frame, but this is exactly the same area. Lumen and stent area 3 square millimeter. The follow-up was 7 square millimeter. And again, this is a core lab that gave us these images. So this is, I mean, there's nothing wrong to have this device. I like it. This is another case, a diffuse calcific LED with distal CTO. Treated with long stents. Again, something that we normally don't do it. Is immediate result. And this is a 9 months follow-up, which is quite remarkable. I like to see the 5 years follow-up of this patient, but it will take time. This is the OCT. In this, we have stent area 3.68. The stent area is the baseline here could not be measured because there was not a good image. At the follow-up, the stent area was 4.29. So in some spot, you may even see some negative. In some other spot, some positive. So I think it also depends how the lesion was prepared, if the calcium was fully broken, etc. But on the average, and this is a summary slide, on the average, you see that the effective lumen area is 7.41 with a relatively narrow standard deviation and goes up to 7.57. So, and these are 50 patients with complex lesion. The maximum lumen diameter, 3.65, 3.64. The minimum lumen diameter, 3.04 to 2.84. And the device area goes from 8.15 to 8.53, again, with a relatively acceptable standard deviation. So I think this enlargement of the device is present not only in simple lesion, but also in complex lesion. May not be consistent to all the lengths of the device because it depends also on how effective was the lesion preparation performed, but definitely this is something that we have never seen with any other stent. Intra-device tissue, the hyperplasia is still there, but is not tremendous. 0.06 as the baseline, basically 0 to 1, and the malapposition area tends to resolve. There is 0.17 to 0.08, and malapposition percentage 1.5 down to 0.59. So these mechanistic data are very encouraging, and I hope they will translate into a clinical benefit. Thank you.